Hello, Dr. Kamol Iskandarov. I welcome you to the MedEdge podcast.
Hello, my name is Kamol Iskandarov. I'm from Uzbekistan. I came here for Marrow Transplantation conference. I'm working in Tashkent city. We have a big hospital, National Medical Center.
Okay.
They have Pediatric hematology-oncology department. I'm a head of the department.
Okay. Let's start with you, Dr. Kamol Iskandarov is,
Yes.
and the specialization he is in.
Yeah.
And let's understand it in brief terms for a layman like me to understand.
Okay. I'm actually specializing for the pediatric hematology.
Okay.
So in also bone marrow transplantation also. So bone marrow transplantation is most important for cancer patients who are suffering cancer diseases.
Okay.
So bone marrow transplantation is damaged for producing the normal blood cells.
Okay.
So it is if the bone marrow damaged, have to infuse the new healthy cells. It is calling the bone marrow transplantations.
Okay. And let's break down what pediatric oncohematology is.
Ah,
How it is related to bone marrow transplantation, and let's have a structure of how it is.
okay. Pediatric hemato-oncology. Oncology is mostly solid tumors. Hematology is belong to the blood diseases.
Okay.
So the mostly blood diseases, bone marrow damaged.
Okay.
So in hematology disease needed bone marrow transplantation. So
Okay.
if the bone marrow damaged, we have to infuse healthy blood cells.
Okay.
This is calling the transplantation, bone marrow transplantation.
What is autologous bone marrow transplantation and what is allogenic bone marrow transplantation? How are they different in general terms?
Okay. So transplant bone marrow transplantation, two types.
Okay.
One type is autologous, one type is allogenic.
Okay.
Autologous, we're using the healthy cells from own body,
Okay.
from the patients.
Okay.
Allogenic one, we're using donors from the other bodies. Be infusing the healthy blood cells to the patients. There's a two type.
Okay. So autologous is from the patient's body itself and the
Yes.
allogenic is from a different
from,
donor.
from different people.
Okay, cool. What is the minimum requirements for conducting a bone marrow transplantation in children?
Yes, there is a three stages. First stage for bone marrow transplantation needed preparation,
Okay.
and then infusing time,
Okay.
transplantation, and then recovery.
Okay.
So each step is very important. It will take 4 6 or more than 4 6.
Okay.
Sorry, it will take 4 weeks or more than 4 weeks.
Okay.
So during that time, after preparations, we infusing the healthy cells to patients, and patients will be in isolation room
Okay.
because during that time, maybe severe complication will be happen. So we have to keep the patients inside the isolation rooms.
Okay.
So important things.
Okay. So let's break the three stages: the preparatory stage, the
Infusing
infusing stage,
and then
the
recovery.
recovery stage. So what happens in the preparatory stage?
Preparation stage, we have to check patients properly. We
Okay.
have to check blood cells, we have to check MRI, we have to check CT, we have to check the ultrasonography, full investigations for donors and patients also.
Okay.
So after that, staging two.
So what is
Transplantation.
the duration of the first stage?
Maybe 1 week or 2 weeks.
Okay.
You take.
2 weeks. Okay.
And then second stage is transplantation stage.
Okay.
It also three steps. First step is collecting the healthy cells,
Okay.
and then second infusing,
Okay.
and then third is we waiting the new cells coming there from the inside the isolation rooms. Or it will take 4 weeks.
Okay. So this process, the second infusing process takes
Yes.
4 weeks and it has
The infusing time maybe half an hour, but producing new cells it will take 4 weeks.
4 weeks.
Yeah.
And the recovery stage? What happens there?
After recovery, we see in the blood cells, new blood cells.
Okay.
So and after that we have to careful because of complications will start. GHD, BOED,
Okay.
and other complications also. So we have to every time look the patients properly because of maybe complications will happen.
Okay, cool. So that is the three stages that you have explained.
Yes.
I would like to pivot to the topic of how are we possible, how is it able to set up a new center for BMT? Setting up a new center.
Okay. So our center is opening the 2020 years. It's a quite new hospital in Uzbekistan.
Okay.
2022 we installed new BMT unit. So for the installing the BMT unit needs first in the specialist
Okay.
and second nurses because BMT unit doctors and the nurses are very specialized in this area.
Okay.
So first doctors and then nurses, and then we have to prepare laboratory, good laboratory, and then we have to prepare a isolation unit,
Okay.
and then we have to teach the parents also
Okay.
because after the bone marrow transplantations, long time we are follow up the period. Parents will be very careful for his or her.
Okay. Thank you. Thank you very much for your time. I appreciate you giving us a very insightful understanding about the stages and the advice to the young professionals.
Yeah, thank you.
Basically telling a reality check.
Thank you
So
very much.
I appreciate for your time. Thank you very much.
Yeah.